Start. Hi, everybody. This is part two of our measles update. I just wanted to say that there's a lot of discussion around measles and patients that will say, well, I think I'd rather have measles than the MMR. And I just want to be really cautious about that conversation because what's really important to understand is that the side effects associated with the MMR are actually related to the measles itself. Measles as a virus is a tough virus. And yes, most people who caught measles did fairly well. Some people got encephalitis, and that caused permanent brain damage or death. You also could die of pneumonia, dehydration, other adverse events that occur after you get the measles. A lot of people live now because we have really good quality health care that can get you through a bad infection. That's actually true. But the virus itself is tough, which means that in a live virus vaccine, which the MMR is, you can have a lot of side effects from the virus itself. I would never assume that you would handle the live version of the measles virus better than the very small dose associated with a vaccine dose. I think people that are susceptible to measles as a virus are susceptible to it wild and to the vaccine, and that maybe we need to look into that and find out who's susceptible to that virus to have bad events. But I definitely do not think that the answer is to catch wild measles. The other thing that happened during the Hannity interview last week was that RFK mentioned clarithromycin, budesonide, and cod liver oil. This was kind of poor messaging because if you are in a concentrated area with quality health care and you get measles, as one of my patients did in the last outbreak, you get taken to the ER and the hospital takes care of you in ways that you need. If you get pneumonia, we do use antibiotics, not usually clarithromycin, but we do. If you need to reduce the swelling on your brain or your lungs, then we'll use steroids, which is what budesonide is. If you get exposed to measles, then we give oral vitamin A, but we do it in a high dose and we do it in a specific amount post-exposure. The problem with recommending these to the general population is clarithromycin is really hard on your bowel flora. You do not want to take it without the oversight of a doctor. Budesonide is a steroid, also something you should not give during active infection unless you know what you're doing. And so this was kind of irresponsible because we use such medicines in the hospital, but you wouldn't want to use them outside of the hospital without physician oversight. Cod liver oil, yes, it has some vitamin A in it, but if I wanted to treat someone for a measles exposure, or in our office, we actually use vitamin A post-vaccination as well. We use a concentrated, measured, known amount of vitamin A, which cod liver oil doesn't have. Cod liver oil actually could be have toxins in it, an overgrowth. It can be poorly made or well made. We never really know exactly what's in it as a category of supplements. So when we want to achieve something in our office, we always say, what is the actual amount that we want to do? Hope that helps, and we'll get back to you more later.